All right, listen to this. New data released by the Centers for Disease Control revealed the largest drop in overdose deaths ever recorded in the U.S. over a 12-month period. Between August 2023 and the same month in 2024, overdose deaths decreased by 22%. The number of predicted overdoses by the CDC is the lowest it's been since August 2020 and comes after they peaked in the summer of 2023. CBS News Homeland Security and Justice reporter Nicole Sganga sat down with Dr. Rahul Gupta, the White House Director of National Drug Control Policy, in an exclusive interview to discuss the decline in overdose deaths. Listen to this.
Do you feel like we're out of the woods?
Not really yet, because here's why. We still have over 90,000 people that are still dying every single year. So we have our work cut out for us as a nation. So while we're making significant progress, what we have learned is those policies and those investments that do work.
Nicole Sganga joins us now from our Washington bureau. Nicole, we appreciate you bringing us some good news today. Dr. Gupta there explaining some of his optimism, but what will help this trend continue to stick?
Errol, good to be with you with good news. 4 main reasons, according to Dr. Gupta. Let's break them down. The first, Dr. Gupta believes that only when the U.S. began treating drug traffickers like, get this, corporations, going after not just the cartel bosses, but the middlemen, the accountants, the lawyers, the real estate agents, and the brokers that move drugs across the global supply chain, did we start to really see this shift. He called it a new chapter, and he also pointed to a diplomatic deal sealed back in November of 2023 after a handshake between President Biden and Chinese President Xi, and that prompted China to target companies that produce chemical precursors used to make fentanyl. Also notable, Dr. Gupta also told me his office has a direct line to counterparts in China, which helps the U.S. government address any new or emerging chemical threats. But beyond that squeeze of the supply chain, there is also access to treatment and harm reduction. And one of the most notable ones in my hand now, naloxone or Narcan, now available over the counter. I just went down the street to a CVS to grab this one. He said every American should carry one on them. He also mentioned some promising treatments, buprenorphine, and the effort to really destigmatize seeking that help if you're struggling with addiction. Lastly, Errol, public awareness campaigns that have really shifted and intensified the public perception on just how dangerous these fentanyl-laced fake pills really are.
A real holistic approach, it sounds like, when you detail those 4 points. Beyond fentanyl alone, though, what emerging threats is the U.S. government tracking when it comes to too many fatal overdoses?
Yeah, Errol, this is important. One of the biggest ones, xylazine. And if you haven't heard of that drug before, you likely will. It's a veterinary tranquilizer, and it's frequently cut into fentanyl pills. That combination on the streets is commonly referred to as tranq. His office also tracking a possible resurgence of heroin, plus nitazene. Now, nitazene is a synthetic opioid, and it's up to 40 times more powerful than fentanyl, so certainly concerning. One thing that also came up in our conversation, the hunt for treatments for addiction outside of just opioid misuse. Take a listen to this piece of our conversation.
We need to be thinking about how do we start to begin investing in research and development for treatments, newer treatments. Today, we have 3 drugs that are available for FDA-approved drugs for opioid use disorder. We literally do not have any FDA-approved drugs to use for methamphetamine or cocaine use disorder. So it's going to be very important to think about how to invest in the next generation of technology and drug discovery to be able to help people.
And Dr. Gupta advocating for that push for treatment options fueled by scientific research to continue into the next administration. Last thing we have to mention, Errol, not every community is seeing this downturn just yet. We continue to see numbers peaking out west in states like Alaska, Nevada, Utah, and in communities of color, particularly Black, Hispanic, and Native American populations. So more work to do there.
At the very least, a step in the right direction. Nicole Sganga, we appreciate your reporting. Thanks for this.
Thank you.